Hello, I'm President Hyunjeong Jang. The development of work area and content for Personal and Dementia Relief Center. 1. Introduction 1.1 National of the Research. With South Korea entered a super age society, the number of elderly people who are higher dependent on aid owing to conditions such as the deterioration of physical function, chronic degenerative disease, and senile dementia has been increasing following brain function impairment due to various causes. Dementia begin with memory impairment in the early stage and then evolve into the cognitive deteriorations of intellectual and cognitive functions such as language, judging, and thinking skill, which lend to inferior ability to perform daily activities such as eating independently, changing clothes, and touring. In addition, dementia is accompanied by behavior of psychological symptoms such as personal change, delusion, anxiety, depression, suspicion, aggression, swelling, wandering, kleptomania, resistance, and sexual abnormality. Dementia patients have difficulty recalling short-term memory of recent events due to their reduced cognitive function. Also exhibit abdominal behavior or various psychological symptoms when their family pattern in everyday life or circumstances change because they are higher sensitive to change in their surrounding environment. Therefore, living with family people in the family environment help other people with dementia maintain psychological stability and reduce the occurrence of problem behavior. In South Korea, 5 specialized dementia hospitals has been operated since 2000 with increased 17 hospitals in 2003. Dementia counseling center we expanded from 48 centers in 2000 to 96 centers in 2003. Since the improvement of the long-term care insurance system for the AIDS in 2008, the number of elderly care facilities has increased by approximately 1,000 facilities every year since registered 4,203 facilities in 2012. However, the level of the condition of the country elderly care facility reveals that they merely is fulfill the basic psychology need the elderly. Thus, they neither respond to the opinions of elderly people nor provide the care they desire. Amid this situation, the establishment of specialized hospital or care facility also is likely to repeat in terms of providing effective health to an ever-increasing number of dementia patients in their family. Ordering dementia relief centers are recommended as more essential and effective solutions through which anyone aged 65 years or older can receive health screening service for dementia, prevention and education program and cognitive enhancement, and can be worked with other institutions. In response to this, the Ministry of Health and Welfare passed the Dementia Management Pact at the National Assembly plenary session in 2018 and then announced the National Dementia Responsible System on September 18, 2017 as part of effort to establish the legal ground for establishing and operation of Dementia Relief Center Hospital, which is one of the primary tasks of all national dementia responsible system. At present, more personal and dementia relief centers overload what to do because they perform them without the division of role. They then also spend expensive time on administrative tasks such as producing forms and charts and managing budget and can potentially expensive overlapping roles or conflicted with other workers because the scope of each worker role is not clearly defined. Overall, the same cognitive enhancement program, the Dementia, which considers the characteristics of the disease are hardly available. Despite the need for diversified research for work are corrupt in performing their duties in accordance with the GIVE guidance. Therefore, at the time when dementia relief centers have been in operation for more than 1 year since their inception, this study intended to identify an error or condition of work perceived by personnel executing this project. Thereby providing basic data that can help define the detailed tasks of personnel and dementia relief centers and increase their work efficiency and continuity. In addition, the study findings and likely and help dementia relief centers to provide guidance for establishing appropriate education contents by developing education and healing programs needed by their personnel and to aid the successful establishment of dementia relief centers by region in the future. Research method 2.1 Research design. This was a methodological study that induced consent through a survey of expert opinions to determine the end contents of work proceeded by personnel working and dementia relief centers in community, including nurse, social worker, occupation therapist, and counseling psychologist. 2.2 Subject to identify the study relevant item of work area and contents. Interviewer contacts with a focus group comprised of 2 nurses and 1 social worker working in dementia relief center to review the relevance of the work area defined and any arbitrary item and modify improve them. The location and times of the focus group interviews were determined according to the participants' preference, and each session lasted around 16 minutes. 2.3 Data collection message and procedure. 2.3.1 Development of work area and contents. 1. Creation of item complete work area and contents. 1. Literature review. To develop the work area and contents of personnel and dementia relief centers. Detailed release of the role and tasks of worker and community dementia relief centers were examined. On the page of 2017 Dementia Relief Center Project Guidelines by the Ministry of Health and Welfare and the 2018 Dementia Policy Project Guidebook. The texts of Dementia Relief Center were divided into 8 main categories, 15 medium categories, and 45 subcategories. 2 focus group interviews. Regarding full limit item, focus group interviews were contact with the nurse of one's social work and dementia relief center to review the relevance of the modify, improve the full limit work consent and find any missing item. 2. Primary or secondary expand validations. 2. Test validity of fulfillment item of work area and contents. An expert group comprised of 8 experts were formed, which includes a neurologist on psychiatric nursing profile on offer of the Health Promotion Division of Busan Metropolis City, one nursing home director with more than 5 years of experience, one manager of the nursing department of the General Hospital, and 3 workers and Dementia Relief Center. A survey was conducted using a question based on 4-point scale defined as follows. 1 point equal not valid at all. 2 point equal not valid. 3 point equal valid. 4 point equal very valid. The item of which of response rate 3 or 4 point was at least 18% were selected and subjective opinions on 3 items were collected. According to the result of primary express validation, the A work area reached on consent with the content value of index CVI value of 0.80 or higher and a total CVI of 0.9 point. The CVI of the 18 work areas range from 0.8 to 0.97 with a total CVI of 0.86. The CVI of the work contents, according to the 18 work area, range from 0.8 to 0.94 with a total of 0.86. The item with the CVI value of 0.80 were corrected, improved, order leader, and the full limit item of work area and contents were reoriginated according to the correct subject opinions. At 5 days after primary contents validation, a secondary contents validation was performed on the work area and contents that were modified and improved in accordance with the result of the first contents validation. As a result of the secondary contents validation, the A work area reached on consent with CVI value of 0.80 or higher and the total CVI values of 0.85. The CVI values of 45 subcategories of the work contents range from 0.8 to 0.91 without total of 0.78. Through final composed item of work area and contents. The final item of work areas were as follows. 1. Counseling, co-registration and classification. 2. Case management. 3. Dementia diagnosis screening. 4. Dementia target management project. 5. Dementia Prevention Management Project. 6. Dementia Family Counseling and Care Support Project. 7. Strengthen administrative affairs and local community capabilities. And 8. Strengthen employee capabilities and message employee welfare. 2.4 Ethical consideration. This study was conducted after obtaining approval from the Institution Reviews Board of K University. The research explained to the participants the study purpose of method, risk the benefit of participation in the interviews, and confidence message. It was also promised of that participants who did not want to participate would be allowed to with their consent at any time during or after the interview without any disadvantage. Participants were also informed that the collective data would be used only for research purposes and that any information they provide would be kept strict confidence. During the interviews, personality identifier information was transcribed by reversing it was simple, and the record files were deleted after transcription. 3. Research result. 3.1 Work area and condition of personal and dementia risk center. The final item composed for the personal work area composed 8 areas. 1. Counseling, registration and classification. 2. Case management. 3. Dementia diagnosis screening. 4. Dementia target management project. 5. Dementia prevention management project. 6. Dementia family counseling and care support project. 7. Transition administrative affairs and local community capability. And 8. Transition employee capability and management employee welfare. The contents of their work were as follows. Table 1. The area of counseling, registration, and classification was complete of 2 items, includes counseling, registration, and classification and service guidelines for the elderly aged 65 years or older. The area of care management consists of 5 items, including case management service personalized to dementia patients. The area of dementia diagnosis and screening was composed of 6 items, includes general early health checkup. The areas of dementia prevention management project consisted of 8 items, includes dementia prevention program. The area of dementia target management project was comprised of 3 items, includes cognitive enhancement program. The area of dementia family counseling and care support project consisted of 6 items, includes counseling and care support. And the area of transition administrative affairs and local communication capabilities was composed of 10 items, includes resistance management through ANSYS. The area of transition employee capability and management employee welfare was composed of 5 items, includes phase education. Consequently, 45 subcategories of work contents were described for the 8 work areas. 4. Discussion. To effectively resolve the problem of dementia with has emerged as social issue. Activity prevention, early diagnosis, and treatment should be provided in the form of community care instead of care led by hospital, clinic, and facility. As a government agent to provide integrative management that combines medical service, welfare, and care, Dementia Relief Center will establish to meet the social demands and needs of other people with dementia, their family, and community residents. Among the success strategies for community care pursued by Dementia Relief Center focus on strengthening the role of the government and public sector important. To this end, it is necessary to build an integrated wage, service, and management system that responds to the demand of recipients. To establish a comprehensive framework going beyond the existing frame of community-centered project of social service characterized by providing direct visit to secure the finance support of work focus and that can ensure community care of public, private sector, and central local governments to strengthen prevention services that deliver the universality and sustainability of health welfare service, to establish a cooperative system across various divisions, ministry, and boroughs which allows the overall cooperation between health and medical care, contributions, housing, and welfare, and to enact a special law regulates the efficient reorganization of the existing service delivery system, such as the strengthening of primary medical care. In the West, the conventional hospital center intensive treatment system has been switched to a community center integrated service system to promote the effective use of medical service at home and the more community for health aging. This is because the prevention and management of chronic disease have become more important with the increasing elderly prevalence with chronic disease rather than acute disease require intensive treatment. Prevention health and medical care and welfare services are needed for those who require to help of others because some difficult in performing diligent activities and caused by chronic disease or dementia. Also needs for elderly people who live in situation of expressive depression due to low incomes for them to recover their health with independently daily lives through effective support. This study was conducted to identify the health and condition of work in personal work and dementia relief center. They by defining their desirable goals and providing reference data that can be utilized for occupational group specific customized education and management. We also intensive to identify the work area of nurse among the various occupational categories and propose ways to develop them more professional. On the basis of these findings, we identified the work area and contents of our work involved the dementia management project, which suggests the need to develop education contents of each specialized work area. Point. Conclusion. To develop the work area and content of Personal and Dementia Relief Center, the present study the conducted to examine the detail relative to role and tasks of worker and dementia relief center in chemistry. On the basis of the 27 Dementia Relief Center project guidelines by the Ministry of Health and Welfare and the 28 Dementia Police Project Guidebook. This was followed by interview with a focus group comprised by 2 nurses and 1 social worker and dementia religious center. Through the process, the relevance of full elementary item of work area and any outer item were reviewed and modified, improved, and the work areas and contents of Personal and Dementia Relief Center were developed through primary and secondary expert validation. The final item of work area were complex of 8 areas. 1. Counseling, call registration and classification. 2. Case management. 3. Dementia diagnosis screening. 4. Dementia target management project. 5. Dementia prevention management project. 6. Dementia family counseling and care support project. 7. Strengthen administrative affairs and local communication capability. And 8. Strengthen employee capability and measuring employee welfare. The area of counseling, registration, and classification was compared of 2 items, includes counseling, registration, and classification, and service guidelines. For the elderly age 65 years or older, the area of care management consisted of 5 items, including case management service capabilities in dementia patients. The area of dementia diagnosis of screening was comprised of 6 items, including general early examination, and the area dementia prevention management project comprises of 8 items, increasing dementia prevention program. The area of dementia target management project was composed of 3 items, increasing causing enhancement program. The area of dementia family counseling and support project consists of 6 items, includes counseling and care support. In the area of strengthening administrative affairs and local community capability was comprised of 10 items, including resistance management through ANSYS. The area of strengthening employee capability and managing employee welfare was comprised of 5 items, including basic education. This final item described for 5 subcategories of work content of a work area.